Good afternoon, y'all. My name is Cristobal Jr., student physical therapy assistant. Today I'm here with Catherine again in regards to stretching, along with how we as a clinician will be doing measuring of the muscles and its lengthening position, either that being of comparison from the left and right side, taking goniometric measurement, or doing special tests. So we'll go ahead and get started, and I'll do an introduction with her. Make sure that she's patient.
Yeah, I mean, as long as you
Hi, Catherine. My name is Cristobal Jr., student physical therapy assistant. Can you just confirm your full name and date of birth?
Catherine Palaio, 4797.
Perfect. So you are the patient on the plan of care set by Dr. Fonts. So yeah, we're going to go ahead and address is a full body stretching techniques, teaching you that along with how we as clinicians would be taking the measurements. So I'll go ahead and wash my hands and we'll go ahead and get started.
It's just
How's your pain today?
it's
It's
so,
good.
obviously,
My
the
neck is a little tight, but
Little tight.
not pain.
Perfect. So even though we are just addressing that neck tightness, here. So I know that primarily you're saying that, hey, it's your neck, that's really tight. But luckily today in the point of care, we're going to go ahead addressing your full body. We're going to teach you some stretching, and then how we as clinicians would be documenting, recording those indications of, hey, that you're feeling tight in this section, either that being goniometric measurements, comparison of just left and right, or other methods. So let's go ahead and get started with cervical stretches. Let's go ahead and address one of the muscles called the sternocleidomastoid. So that muscle, the SCM, that's in charge of flexion, lateral flexion, and also rotation.
Okay.
So we're gonna go ahead and address that by just doing the opposite stuff. So if we want to go ahead and stretch that right side, and you can go ahead and just follow my demonstration with me as I do it. We'll go ahead and let's stretch that right. Let's go ahead and turn our head to the left, ear to your left shoulder. Go ahead and rotate that chin to the right side. If you want to add an additional stretch, let's go ahead and chin to the sky looking up. You should feel that nice stretch going on in the front of your neck. Perfect. So the SCM, while you're doing that, let's hold that for 30 seconds. The SCM is it originates from the top of the manubrium, along with the clavicle, the medial 1/3 of the clavicle. It's going to go ahead and insert all the way to the mastoid process of the temporal bone, so right behind your ear, and then the lateral portion of the nucleus of the occiput. So that big protuberance going on in your head, more on the lateral side over here.
Got it.
And then that's both left and right. So you just did your right side. And let's go ahead and do the left side. So it's lateral flexion to the right. Just like that. And then chin to the sky. Hold that for 30 seconds. And for right now, while you're doing that, since you just did your right side, we're gonna go ahead and stretch a little bit left. What do you feel is more tighter?
This side, my left side.
Side, your left side. Perfect. So that's actually a way we can go ahead and measure that muscle and indicate that it is tighter in our notes as clinicians, just by comparison, asking the patient. Certain muscles, they can be just addressed like that, like, hey, asking the patient left and right, whereas others, we have to go ahead and get a goniometer, inclinometer, and get a goniometric measurement. And just for your awareness too, that muscle, the SCM, doesn't have any active or passive insufficiency. And that's addressing, again, flexion, lateral flexion, and rotation. But now we want to go ahead and address the muscles that are in charge of extension, lifting up. And that is the levator scap. So the levator scap, that's in charge of, once again, cervical extension, lifting up, lateral flexion, and rotation. So kind of the same thing as the SCM, but instead of looking down, it's in charge of looking up.
Okay.
So let's go ahead and stretch that out. What I want you to do is rotate let's stretch out your left side. I want you to go ahead and look right and look down as if your nose is trying to go and sniff your armpit. That's like the best way to think. And if you want to add additional stretch, go ahead and grab that right hand, put it right behind your head, and push down. That's going to really, really put and generate a force to go ahead and stretch out that muscle and hold that over 30 seconds. While you're doing that, I'll go ahead and let you know that, hey, it originates from the transverse processes of the first and fourth cervical vertebrae. So coming from your spinal cord area, and it inserts into the medial border of your scapula. So one of the bones in your back.
Got it.
Perfect. And then you go ahead and do that again. Sniff the left side of your armpit and push down your left hand behind your head. And which one do you feel is more tighter?
My left is definitely tighter.
Left side. So primarily it's like a left side thing where it's needing more stretching. So we'll go ahead and indicate that for both the SCM and levator scap. Mainly primarily extension, lateral flexion, rotation, and extension and flexion. I think I said all that. But yeah, we'll indicate that, hey, it's your left side that's feeling tight, and we'll go ahead and stretch those out. And that's our clinician indication, what we can go ahead and type down and record that, hey, patient is feeling that her left side is more tight than the right side. And just like the SCM, this muscle, the lateral levator scapula, doesn't have any active or passive insufficiency. All right, we're back. Catherine had a previous change and also a name change to Valerie Valeria. So we're gonna go ahead and address her thoracolumbar flexion, extension, lateral flexion, and rotation. And what we can do is stretch out the quadratus lumborum muscle, which is in charge of extension and lateral flexion of the thoracolumbar region. So, Valerie, all I have you do is you go ahead and stand up. And with this stretch, if we want to go ahead and stretch out your left side, let's bring our left arm up. And just go ahead and drop right across forward, almost chest to the ground if you can. Maintain that balance, and you should be feeling a stretch on your lower back on that left region. Perfect. Hold that for 30 seconds. And while you're doing that, I'll let you know that, hey, it originates from the iliolumbar ligament and the iliac crest. So where your hips lie, and then it inserts to your very last rib along with the transverse process of the first, third, fourth lumbar vertebrae. So spinal cord and your ribs, well, one rib. Sections, do lateral flexion to the same side, along with extension of the vertebral column, which you are stretching out right now by going into flexion and lateral flexion. And then since you're going on the opposite side to the stretch, that's why it's stretching good. Perfect. You can go ahead and relax, and just do the same thing with your right arm up top, and then bending over to the side and forward. Which one do you feel is tighter? So your right side is tighter, so we can go ahead and document that because this is an observational measurement we can go ahead and take to assess core muscle length just on the patient's opinion. And this muscle, the quadratus lumborum, it does not have an active or passive insufficiency. Just for your awareness.
She said, please don't let this generosity lead to procrastination.
That's that. How you feeling?
Good.
Nice. So that addressed extension and lateral flexion or thoracolumbar by with us stretching it between those actions of flexion. And now let's go ahead and address flexion and rotation, which let our obliques go ahead and do. These are side muscles over here in charge of rotation, but together they can go ahead and help us flex the thoracolumbar region just like that. Pretty much like a crunch. So, what I'll go ahead and have you do is if you can have a seat right here.
I mean, there's only 2 cameras.
This is where we take a goniometric measurement. So I'll go ahead and grab my goniometer right now, and we'll go ahead and get an initial and a post-performance goniometric measurement on her thoracolumbar rotation. Pretty much what we're going to be doing is from your seat position, keep those hips nice and still. You're going to do your best to rotate to your side. Place it behind the type core, the crumbing process and following your hip. Perfect. And you can go ahead and rotate to your right. This one you got about.
Yeah. What else is smart?
Pretty good range. You have.
That's it.
So 55 degrees on your right side, so you're lengthening that right side. And go ahead and relax. We'll go ahead and do on the left side.
Wednesday, you have to wear that again.
Go ahead and rotate to the left.
And then Thursday, you can wear jeans and orange.
So this one is
But you also have to
45
wear
degrees. You're still within normative ranges. With this number, I'm seeing that probably is going to be your left.
Oh, yeah, and you
That
have
is
to come
tighter.
for the pumpkin.
oblique being tighter. It's actually her right oblique going to be tighter because of the range of motion, because it's addressing rotation to the opposite side. So we'll go ahead and stretch out both and see if we can go ahead and get an improvement in the range of motion with that.
I don't even know what your favorite is.
Go ahead and move this down. All I'll have you do is the open book stretching. You can go ahead and do that. Do you need a demonstration? Yeah, you do. So you go ahead and stand. Sorry about that. I'll go ahead and demonstrate right here on the table for you.
Mia, Gianna, David.
Open book will be side lying. Want your hips right in line together. It's kind of like this. Arms come across like that, just together, and then you're going to rotate from the upper body and keeping those hips still nice and in line as much as possible. You're still going to have some rotation going on. However, you try to keep those as straight as possible. You're going to go ahead and feel stretch coming on your obliques because it's rotating just like that. And you go ahead and do that.
What do you think your birthday?
Perfect. And that will go ahead and open up depending on the side you're turning to. As you turn to your right, you're opening up your right side.
Honestly, doing stuff for my
Perfect, and then just hold that 30
My
seconds.
homie requested the day off. He's like, hey, bro, I got the day off for your birthday. Let me know what you want to do. But they're like, my girl wants to kick it. My family's probably going to want to go to dinner. I'm like, bro, like, I'm trying to
So how's that feeling on your right side?
That's why I'm doing my birthday myself.
My homies all want to like kick it. And I'm like, bro, I got like 3 hours
Good.
of time.
Good? Like a stretching feeling and you're feeling that tension of stretching.
Yeah.
I usually just spread it out, like go to dinner, like
Yeah.
or something. I just going deep, bro.
So for your awareness again, too, this is originating from the external surfaces of your 5th and 12th rib. So your ribs up here. And that's going to go ahead and insert all the way to the anterior part of the iliac crest and erect the sheath of the lineal. So more towards the front of the body. Again, once you go ahead, it comes across your body. That's in charge of rotation. And if it's working together, it'll go ahead and help with flexion. But we're addressing lateral, not lateral, we're addressing extension along with rotating to the same side that we're stretching. Right side stretching right side, left side as we switch to that, which you can go ahead and switch now. It's been 30 seconds. Left side will go ahead and stretch out the left side. There you go. Good job, though. In this muscle, there's no active and no passive insufficiency for it.
I was trying to portray to you how much I don't want to do this.
I can see it in your eyes.
I could see
Okay.
How's that left side feeling for you right now?
Yeah. I did really well.
This one's feeling
Alright,
good.
anyway.
Just put your hand on her.
I really can't do it on my glasses.
In the shoulder. Oh, okay, so let's just stretching out your shoulder. Man.
I'm just looking out for you. I don't know what you marked.
Yes, so the gravity stretching that out, it's putting a shoulder stretch going on in your anterior delts, but that's something we'll address.
What do you sound like?
Eventually some.
Talking 5 What is it? Stage 4? Stage 5?
I don't know any of that. I mean,
Go ahead, 10 more seconds.
All that lecture shit. At first I was like, after that PVT game, I was like, I'm gonna pay attention to it.
You will?
We'll go ahead and come back together, put it together, and we'll go ahead and do that. Post goniometric stretch measurement again.
Neuro would have been better if it was. That stuff actually is interesting.
Making sure before you
No, I know. I was like this, like.
so we indicated 45 going from the side. Go ahead and see if that's improved just by because you stretch out your right side. Right side is again in charge of rotating to the left side because obliques rotate to the opposite side. You stretch. So I realized in the original recording I made a mistake in describing the lengthening process. So while the right is involved with the left rotation of the obliques, the right side is shortening and the left side is lengthening. So in this clip right here, Valeria is turning to her right side, which is lengthening her right oblique and shortening the left oblique. And then in here, she will turn to her left
and then it will lengthen her left oblique, and the right oblique shortens to cause the rotation. So by doing the range of motion in here and seeing if there's an increase in range of motion, we are seeing if her left oblique has lengthened to allow her to achieve that increased range of motion.
Alrighty, so now we are going to go ahead and address our shoulder muscles. So shoulders, that's addressing flexion, extension, adduction, medial rotation, internal and medial rotation, and external lateral rotation. A lot of things that your deltoid does. So it's simple when we can stretch it on itself. Notice a lot.
Yeah.
Deltoid is primarily this big muscle of your arm. It's not a big cap. We can go ahead and stretch out the anterior fibers and posterior fibers. We'll go ahead and start with stretching out the anterior fibers of the deltoid. So what we'll go ahead and do is a stretch that puts it into the opposite position. So it's in charge of flexing the shoulder like this, medially rotating the shoulder, or eventually abducting it as well. Bring it together like that, and abduction of the shoulders, but that's with the posterior fibers. So we're addressing a lot of the front range of motion in depth with the anterior fibers. So we'll go ahead and stretch that out, and instead of doing the opposite, we'll bring it back low and put a force right here. It could be a doorway, it could be this bench right here. So go ahead and stretch out the fibers.
Alright.
Measurement, what we'll go ahead and do before we do our stretches
Your right side?
is we'll go ahead
Okay,
and
so
just bring
I'm
it
going
on
to get
straight
you stretching actually
just like
to
that.
the
Try to bend
So,
that
the
shoulder
horizontal
back
adductions,
as
I want
much
you
as
to
possible,
put
kind
your
of throw it
arms
back
out
so
in
it's
front
nice and straight, just
So
like that.
there, I'm going to
I'll go
hold
ahead
this down.
and use this going here to go ahead and measure you, bring it in together.
And then what I'm going to do
Adduction,
is I'm going to have
outside
the straight arm, kind
abduction.
of like
Once
the
we
top of your
stretch, we'll go ahead and
chest. You're
see
going to bring
how
your arm
that
across your body.
improves.
And you're going to measure. Go ahead.
This is going to be a chrome process for your
Are at
right there. Have it in line with your hinge
5
right now.
degrees of
We'll go
horizontal
ahead
adduction.
and
Go
bring
ahead
that
and take a
together
break, and then
towards
we are
your
going to do the
right
opposite way.
side.
So you're going to start with that arm out in front, and then you're going to bring it back as far as you can. Try not to let your shoulders rotate
that.
backwards. So
Okay,
it's just
perfect.
all going to be in that
So
arm,
we
okay?
got you at 8 degrees range of motion going that way. And go ahead and bring it outwards to your left side.
24 degrees of horizontal adduction. Alright, so those are the tests that we can do for the deltoid. Oh, just kidding, we're gonna do this too.
So we got you now over here with
Sorry.
80 degrees range of motion.
Alright,
So we'll go ahead and
same thing,
stretch
arm out in front and then
and see
go ahead
how we can get
and
improvements on that.
Or sorry,
There's really no normative values for these tests. It's really seeing how it is a feat to improve once we are stretching them. Alright, so we'll actually be using this fridge to go ahead and get leverage for our arm and hand that we're stretching out your left side today. So with that, we'll go ahead and just come up to this fridge, elbow bent, nice and relaxed, and pretty much we can go ahead and keep that elbow tucked to your body and just rotate to your right while forcing your hand into the fridge. Obviously it's a movable object, so it's going to create some resistance, and that's going to go ahead and stretch out that anterior fibers of your deltoid right here.
4th and 1, going for it.
Any clarification? You got it?
So, hand right here.
Exactly that, yep. And either you can go ahead and have that elbow bent and tucked, or straighten out. I personally like it when it's tucked, just for the focus on the front deltoid.
So, first one I want you to do is with the right,
Hold that
just
for
lean
30
across your chest.
seconds.
You're
And
gonna
while
grab
I
on
do
with your
that,
left and pull
this
it into your chest.
originates from the lateral 1/3 of the clavicle,
This is your posterior.
the acromion, And then also the
You're
spine
doing a
and the
posterior cuff
scapula.
stretch, you're holding up for 30
That's
seconds.
all the deltoid,
And then
honestly,
you can
but
push on over
with
to
the anterior
that
fibers,
left
more
side.
comes from the acromion
So
and lateral
deltoid
deltoid
performs
clavicle.
abduction,
But it
flexion,
all
external
inserts to your deltoid
rotation,
tuberosity,
horizontal
so it funnels
It
in
originates
into
on the
one
lateral
spot in the
third
middle of
clavicle,
your
the
arm.
acromion, and the spine of the
And
scapula.
then additionally,
It inserts
there
on
is
the
no
deltoid
active or passive
tuberosity.
insufficiency of the deltoids.
Like I said, it does a couple different things, so that's what we're addressing. So this is your horizontal
And we'll go ahead
abduction
and measure your muscle
right there.
after
and
we stretch out the
after.
posterior deltoids.
And
And
to
relax.
address the posterior fibers,
Perfect.
you're going
And while we're
to
here
be
with the posterior
a
deltoid,
seated
it's a nice and
wedge-
simple
seated
one.
wedge
I'm going to switch positions with you real quick. Show the camera. This one is what a lot of us know as the cross arm stretch. I'm sure you've probably seen it. Pretty much just bringing your arm across your chest, bring your other arm across it, and you're just helping and pulling that arm backwards. This will go ahead and stretch out this posterior fiber and go ahead and hold that for 30
Okay, go ahead,
seconds.
hop off the table and then sit
Okay.
in that chair there. So what I want you to do is you're gonna face
Perfect, just like
sideways.
that. And you should be
You're gonna
feeling
put
your
your
wrist
arm-
region right here. So getting stretched out.
There you go. Back up just a little bit because you don't want it so high. Go ahead and put your elbow and your forearm on the wedge there.
While you're
And
doing
all
that-
you should do is you're gonna lean forward with your shoulders.
This muscle, the posterior fiber of the deltoid, some origination points of the lateral one-third of the clavicle, acromion, and the spine of the scapula. Again, it's coming from the posterior, so more it's coming in the spine of the scapula and the acromion. With the
There
insertions, this is again to the deltoid tuberosity, that middle point in your arm.
So once you're done, I'm gonna get you seated on the table.
Actions are to extend the shoulder, laterally rotate the shoulder, horizontally abduct the shoulder, then abduction of the shoulder up wide, but that's internal with the anterior fibers. And then there is no active or passive insufficiency for this section of the fibers for the deltoid. Everything, go ahead and relax. I'll go ahead and measure you back. All right, after we're done stretching, we'll go ahead and do that same range of motion measurement again. So
Good?
I'll go ahead and have you bring that arm up.
Alright, good
So
stuff.
just tuck that, bring your shoulder blades back.
There you go, man.
There you go. Position you. Let's see how you can go ahead and improve. Growing process, midline of your humerus.
So much shit.
And go ahead and bring that to your
You're gonna put your
right.
gun back on here.
Sorry, that hit your head. So that improves to 50 degrees prior to our 30 degrees. Oh, actually,
What's
midline to the humerus, now it's at 45 degrees. So we got that. Now go ahead and bring that back to the neutral position.
How are you back here?
There. And go ahead
What?
and bring that left out to your left.
You're up.
Oh yeah. There we go.
Okay.
So right here, we got you to 100
I'm gonna
and
please, I'll
5
hear your car.
degrees
Just anyhow.
of horizontal abduction. So with stretching, when we did
It's really
the
not.
anterior fibers and posterior
Yeah,
fibers,
sorry,
like the cross arm,
you know,
and that static
me.
hold against the fridge, that improved her range of motion, both abduction and adduction. All right, so now we're gonna go ahead and address the elbow joint. That is very much more simple than the shoulder joint, honestly. All it is, flexion, extension, nice and simple stuff. We're gonna go ahead and address stretching it, both the tricep and the bicep. Well, first we're gonna go ahead and do our goniometric measurement to go ahead and assess what the length is right now for the bicep and the tricep, which we can go ahead and do lying down. So let's start with the bicep. You'll have you laying down head over here and then some up, laying on your back. And then what I want you to do is, while your hand is straight just like that it is right now, and then scoot to the side where your arm goes off the table. A little bit more.
It's because there's more to write about than
And
opposed.
you can
Is there?
straighten out your elbow as much as you can.
Did you read the
As
Ashley
far
treatment?
back. Then let's go ahead and address lateral condyle.
This is basically where like
She's like a 6-year-old girl.
oh yeah.
Yeah, do that.
Movement arm.
Side
We're gonna bisect your humerus and then swallow your.
That's where the parents said something about her.
Well, yeah, she's like 6 and they
What's
got
she
her a
six?
hysterectomy.
Oh, I was like,
Basically a mastectomy.
So-
That's pretty.
That's great. That's what I'm saying. Why don't you want to against it?
Because I just
-1. So
I don't know.
you'll
Yeah, all you need to
shy
back up is that
of,
the
complete
parents thought
elbow
they had the best interest, but
extension,
all they're doing
meaning,
is assuming.
Not exactly, basically.
Well, they're just assuming that everything's
This-
gonna happen.
yeah.
Plus
And
1
there's-
would have
say that.
0 in
I know, and
extension.
there's even people
So,
like
you're
that
shy
actually
of
have, as they
elbow
grow older,
extension
they don't have
because
any
of the tight
complications
bicep.
to the extent.
Well, that's
And
the
then now
thing.
go ahead and
You
do
might
the
even cause
triceps muscle to
complications.
see the lengthening.
So,
Have your arm just like that, facing up, supinated.
studying.
Bring it all the way back and bend that shoulder like you're trying to
Sorry.
not bend your shoulder. Bend your elbow.
I know you're more
I'm gonna say him like this way.
Perfect, just like that. And are you limited by this table?
Not good, I'm fine.
Yeah, you can scoot to the edge.
Why
That's perfect.
people were telling me the semester 2 was easier? No,
Let's get on
wait, semester 3 is easier than 2.
follow the
Most of the semester is easier.
I think somebody
Yes.
told me.
Some people say semester, if you haven't had experience in the clinic, semester 2 is harder.
It all depends. No,
I guess that's what they say.
There's a different thing. Semester 2 is more assignments than knowledge, but semester 3 is more knowledge than assignments.
No, there's a
we have hell
of
assignments,
assignments.
huh?
I can't do that. We have sheets. So.
Yeah, we have like 9 things due on Sundays.
Well, no, we still have that many
Those
too. So I'm
days.
saying like,
Those
semester
days.
2 is like obviously skill check after skill check. It was just constantly on the go. And it's a lot more.
I feel like
I mean, yeah,
it's
it's
just
still
not
like
rush.
the art has assignments, but it's just
9
it's harder. And
degrees.
just because of knowledge.
We'll go ahead and
I don't
see
know,
how
yeah,
much
so-
we can improve that tricep when we stretch that
Whatever
out.
the fuck is required
So-
in college. But I feel
Go
like
ahead
this
and-
is more like theory, where
There.
semester
Sit
2
up.
was more hands-on.
And
No,
you come to the
yeah,
edge of this table right here.
But this is better.
your left side.
Because you guys are very
Of
sorry,
course.
just literally and putting all
Sorry, you mentioned your right side.
different
It's one of those days.
Right.
We'll go ahead and stretch out that right side. With stretching out that right side is very similar to what we did with the
bad,
fridge.
Jazz.
But that's
That's how you were with the bent arm, bent elbow. We really want to emphasize that straight
Why are you
elbow.
looking at phone? I didn't pay attention.
You'll go ahead
I sit there on
and
my phone.
Average?
Actually,
What was the average?
lean on onions
There isn't
Fucking
say yet, but
30%
like I said, the
forward.
highest is Tania.
with some
Or
shorter
she had
going backwards right there
34.5.
in that direction. Let's go ahead and stretch that
those are
bicep out. Because the
So
biceps
even like a
control
train
your
like
shoulder
40 to
flexion and
60.
elbow flexion. We're doing the
Oh, I mean, that's what
opposite.
it was for
Elbow
the lesson,
extension,
like Dr. Manuel.
shoulder extension. Stretch that out
I went
for
to check my
30
first
seconds.
music exam. I think I
Now
realized
stretching out your biceps brachii.
Did you have
It's
to point
originating
like
from the
thing at the
thoracoid
end?
process of the scapula.
Well, I did this
Over
for.
here,
Hello?
the scapula more towards the front side,
What?
and then the supraglenoid, the tubercle of the scapula. So 2 points in the
It's
scapula.
actually hard enough.
And it
I think
inserts
this is
into the
much-
tuberosity of the radius. Coming
This
from
is
the
much-
I know
scapula.
whatever posture, near posture.
Brachii. Actually, like I said, elbow
I
flexion.
think.
You,
elbow
you
flexion.
know what, the
and
thing I put away
supination
yesterday was like
forearms.
spaghetti noodles.
So-
Yeah.
This muscle, I know we've been mentioning it a lot now, active passive insufficiency. This one actually does have active passive insufficiency. Right now,
I didn't put that
you're
away.
actually putting it into passive insufficiency almost.
Well, that's
So
me, that's what I
once-
mean from before.
If you want passive insufficiency, with similar to what you were doing right there, you would rotate it facing that
I
way.
know I said I'd do stuff on you, but I think
Active insufficiency is when you want to get the most shortened. Just like that. That's passive insufficiency. Like trying
I
to
just
bicep
don't feel like
flex.
taking measurements right now.
To try to touch your shoulder. Active insufficiency can't shorten it.
When did you get
Sunday.
Shoulder flexion.
Yeah, we're almost done with the.
And then now we'll go ahead and stretch out that right tricep. What we'll go
Hello?
ahead and do is,
Is it outer
like you're trying to the middle of your back, just like this.
Oh, no, I didn't. You don't have a fob?
And then with your left hand, go ahead and push down right at your elbow. And give that nice.
Oh, no, I
tricep
didn't.
stretch
I
for
thought you had a
30
fob, that's why I didn't know. Oh, that's crazy.
So-
And they put you to close?
The triceps brachii, that's originating from the
Yeah, no, yeah, my bad, bro. I didn't know that.
The posterior
Alright, do you know how to
surface
lock it up?
of the humerus over here,
So,
and then
Hungry?
the posterior surface.
okay,
of
well,
the
just for future reference,
over there.
the code is
And it all
bottom row,
inserts-
which
Is
is
it one spot or how many origins?
7,
it has?
8, 9,
It all inserts the like around across the arm.
6, and away, and then literally after that you use fob, and use literally fob from the outside, which is very simple. But if you don't have it, then you can really do much.
You're doing abduction of the shoulder.
Alright, bro. See ya.
Shoulder. Slight extension going on, depending on how you put it. It's not really going too far there. but we'll push
Wanna do
back
that?
elbow flexion.
This random guy that I don't even know who he is called me to see if I select the clinic.
You can random guy.
Oh yeah, you're good.
Well, I thought-
Relax, sorry.
I don't want to do this since I don't
Yeah,
like
that's what I'm telling you.
We're not past 45 seconds.
Because he was there and he's like, hey, Rick, do you have fun?
Now,
I'm like,
go ahead
yeah.
and have you lay down.
But he's working, he's closing. And then
Is there any active or passive insufficiency?
Great question. I'm glad you're
He was still with
wanting to know that stuff.
Like, besides
Some
taking
goes
him,
on.
he was taking him from modalities or something. So I took off and
So
he
remember
didn't
how
tell
the
me
passive
how.
insufficiency of the bicep was.
How would I know he doesn't have because he's fucking working?
That's how it was
That's actually
too,
active
when I
insufficiency
first
of the
started.
tricep.
Because I remember I had no problem, like I wouldn't always have someone watching
Passive,
before.
or passive insufficiency of
I didn't get a false
the
weight
tricep.
until I started asking.
It's that.
Yeah, that's crazy.
The elbow flexion, shoulder flexion, and reaching back. That's going to put this into passive insufficiency of the tricep.
You can't tell if he's explaining something or not.
The table, here again. And then go again with the palm down, facing down to
Sort
the
of
ground.
talk about the
Go ahead,
lumbar,
bring that out as much as
shoulder,
you can.
and elbow.
I'm going to go ahead and measure and see if we got the
So, like, all those are hella so against it. It's helping me get it, but it's
Follow into
just.
And just like that, we actually did provide you a stretching of the biceps and brachial.
I swear
Because
she
now
said
we're
that. I'm
actually
not making
plus
that up. Didn't she
five
say like there has to be
in
positive
elbow,
tests?
in
The
elbow extension,
tests
meaning your biceps went ahead and lengthened during that stretching process. So nice job with that stretch. I see you follow instruction well there.
Thank you. I'm not
And then now we'll go ahead and do that. We're reaching behind for your shoulder. There you go. Slide a little bit. Nice. And even visually, I can see an improvement. Let's go ahead and get going a metric measurement.
I just think if we just, because you don't have to do a video and then we felt like all of the stuff. I think if we just did that first part. That's okay. Yeah.
Because that already tells you that you're learning about it and then hopefully you study the same shit that you'll be.
Got you. I'm not worried about that. Let's switch the
I
station.
think it's
I'm
because,
sorry.
I think it's because of,
It's one of those days.
you know, like people who had to do like ultrasound 3 times.
Got you there at 41.
I don't know.
If okay, but let's think about it. If our little sense,
41.
so you're doing good. For
Yeah. But because of the degrees actually reducing, that means that length is very much more. Alright, so now we're moving on to the wrists and fingers, which include the actions of flexion, extension, radial deviation, and ulnar deviation. However, we can address those with certain muscles of the fingers that address flexion, extension in the wrist. So we'll go ahead and knock out getting the measurements right now, and then we'll address the flexor carpi ulnaris, flexor carpi radialis being stretched, and then the extensor digitorum and the flexor digitorum superficialis. So we'll go ahead and get started with measuring radial deviation and ulnar deviation, so we can go ahead and get lengthening for the flexor carpi ulnaris and flexor carpi radialis. So I'll get this on the capitated. And then on all that. Our normative will be when you do ulnar deviation, so towards that side, if you can look at that. Go ahead and be here at 40 degrees. You have a lot of range of motion for that. So that's going to go ahead and stretch out your radial flexor carpi radialis. And if you go ahead and relax, bring it back to the normal. And if you go ahead and deviate it that way, you are at 20 degrees in radial deviation. So actually 21, so just right above normal range of motion. And we'll go ahead and stretch out the flexor carpi ulnaris for that. Additionally, I do want to start with getting wrist extension and wrist flexion. So I'll go ahead and have you bring your arm out to the table. Place that right here, and triquetrum. There. And go ahead and just straighten that out for me. And then now go ahead and flex down that wrist. And here at about 6 degrees, right here, this is going to go ahead and stretch out your extensors. If you go ahead and straighten that out again for me. and bring it back up. Now you over here at about parallel painting. There. You at 68 degrees of wrist extension, which is stretching out your flexors. So we'll go ahead and give you some stretches for all those muscles that we just tested. Right now for lengthening, we'll go ahead and start with the flexor carpi ulnaris. For this stretch, what I want you to do is you're going to go ahead and push into radial deviation just like that. And I want you to take your other hand and just pull at the base of your hand over here. And then go ahead and stretch out that flexor carpi ulnaris. Hold that for 30 seconds. While you're doing that, its origin is the common extensor tendon from the lateral epicondyle from the humerus all the way up here. It inserts to the base of the fifth metacarpal, so that side where you're pushing from, the metacarpal right there. Its action is to extend the wrist and then also adduct the wrist, which is the ulnar deviation. Obviously, you're doing a static stretch. Us measuring the muscle was using the range of motion with the radial ulnar deviation, and then there is no active or passive insufficiency, at least for this muscle in the wrist when it comes to the flexor carpi ulnaris. And then you'll have relax. Now let's go ahead and flex or stretch out the flexor carpi radialis, which is going to be the opposite of going into ulnar deviation. I want you to go ahead and push right here at the base of your palm, just pushing that into stretching that muscle right here at the flexor carpi radialis. While you're doing that, its origin comes from the common flexor tendon of the medial epicondyle of the humerus. So over here. Actually, I'll need this one. Yeah. The origin comes from the flexor. Sorry. The origin comes from the common flexor tendon from the medial epicondyle of the humerus. It inserts into the second and third metacarpal, so right below your index and right below your middle finger. Its action is to assist with flexing the wrist, abducting the wrist, which is the radial deviation, bringing it together, and then may assist with elbow flexion. While you're doing that stretch, also, we just measured the muscle lengthening by doing ulnar deviation, which lengthened out the muscle for this flexor carpi radialis, and there is no passive or active insufficiency of this muscle. Perfect. Go ahead and relax. Now let's go ahead and address with stretching out the extensors. The extensor digits one specifically. All you go ahead and do is drop that wrist nice and relaxed down. Flex your fingers as much as you can. Now you're actually going into insufficiency right here for your extensors passively. What I want you to do is grab with your other hand, just pull those fingers. Perfect. You're going to go ahead and feel a nice stretch on the top of your forearm, and then also even in the base of your fingers. So like I said, you are, how are we doing? Alright, so as you're stretching that extensor digits one, its origin is coming from the common extensor tendon from the lateral epicondyle of the humerus. Its insertion is the base of the middle and distal phalanges of the second through fifth fingers, so 2, 3, 4, 5. Its actions are to extend the fingers and also wrist extension, which is why we're doing that opposite, so we go ahead and get a stretch. Measuring it, the muscle was obviously us doing that wrist flexion, the end of the bed, so we can see how much range of motion you can get before it's limited due to it just being too shortened. Its active insufficiency is if you were to go into wrist extension and try to provide finger extension, and then passive insufficiency if you go into finger flexion and wrist extend or wrist flexion. So that's in 30 seconds. You go ahead and relax. Next one we're gonna do is the flexor digitorum superficialis. For this stretch, since it's a flexor in charge of that, I'm gonna obviously do the opposite. Let's go ahead and extend that wrist, extend those fingers, and with your other hand, you can go ahead and push, in your case pull, as we're doing, giving a backwards motion towards those fingers. To give additional extension, you're stretching those out. We'll go ahead and hold that for 30 seconds. And as you do that, its origin comes from a lot of things. It comes from the common flexor tendon, from the medial epicondyle of the humerus, the ulnar collateral ligament over near your elbow, the coronoid process of the ulna, the interosseous membrane, and then the proximal shaft radius. A lot of places, all just put to insert the little phalanges of the second, third, fourth, and fifth fingers. Obviously, like what we said, its actions are to flex and for the fingers and the wrist, and hence why we're stretching it like that. It's for us to measure the muscle length, is obviously for us wrist extension up until the point that your stop. And then with active and passive insufficiency. Active insufficiency is when you're flexing and doing wrist flexion. Passive insufficiency is when you're extending and doing finger extension. So you can
It's literally
relax.
from.
I know.
So let's go ahead and get those
I could just do it then.
posting measurements. I'll go ahead with the deviations, ulnar deviation, radial deviation. So let's see how the flexor carpi radialis has lengthened. So we can go ahead into ulnar deviation down here. Oh, yeah, that's a lot more. We got you at 50, so you're over that 40 that we originally had. Nice. Go ahead and relax.
Just
Now go ahead and we'll measure the flexor carpi ulnaris.
I think that would be the
by going to radial
easiest, not
deviation.
sure.
So go ahead and twist that hand halfway as much as you can. Nice. And right there, we're about the bicep forearm. Right there, we improved you 3 degrees. You're able to push into 24 degrees of range of motion into radial deviation because of us lengthening that flexor carpi ulnaris. Next, end of bed.
My God.
Next end of bed.
Stupid.
Decapitate. Go ahead, go into wrist extension. So you're gonna address your flexors.
Website's still down.
Flexors, you've gone ahead and improved 2.
No, it's not.
Wait, who's trying to do it?
75 degrees of wrist
Module 2.
extension, meaning your
There's
flexors
one
will
extra.
stretch. You can go ahead, wrist flex down.
Total.
Yeah.
You went and improved all the way to 85 degrees. So you're doing
That's not
on
working.
your motion for wrist flexion because of us stretching out those extensors. So that's that for wrist flexion, wrist extension, radial and ulnar deviation, and then also finger extension and flexion. The body, we're addressing the hip. This is in charge of flexion, extension, abduction, adduction, internal or medial rotation, and external or lateral rotation. 2 muscles that will hit these actions are the glute maximus and then the tensor fasciae lata, along with its attachment of the iliotibial tract. So for now with Ashley, we'll go ahead and show her a glute max stretch to address extension, lateral and external rotation, abduction of the lower abduction, and then the lower fibers actually are involved with adduction. So that's hitting 4 actions over the hip. So for this one, Ashley, for this stretch, what we'll have you do is, well, prior to the stretch, we'll actually do a hip flexion measurement. So if you go ahead and lay on your back on the table. And what I'm just gonna have you do is bring that knee to your chest as much as you can.
Can't
relaxers. Just relaxers. So then, so you go ahead and tell me, you will go ahead and find the greater shotgun.
I'm so sorry.
Oh, you're all good. Go ahead and internally rotate your hip.
Flex.
Internally and rotate your hip. trying to think right here. No, good.
Yeah, you're fine.
Lateral epicondyle. Sorry, I'm just trying to call it epicondyle. Perfect. And now go ahead and flex that hip up. Knee to the chest. Here. That might be limiting it.
Mm-hmm. No, they're not.
So right now I have you at 114 degrees. That's what's lateral. Right there is at actually 219 degrees of hip flexion. So hopefully when we stretch out the glute max, we'll be able to go ahead and increase that range of motion going on with your hip. So what I'll go ahead and have you do is for this stretch is we measure your right side. So with your right leg, go ahead and have your knee internally rotated so your knee and foot is going outside towards your left. And try to bring this knee to the opposite of your chest, or your left chest. You should feel a stretch going on with your glute max. Hold that for 30 seconds. And while you're doing that, its origin is the coccyx, the edge of the sacrum, posterior iliac crest, the sacrotuberous, and the sacroiliac ligaments. Its insertion is the iliotibial tract, along with the gluteal tuberosity on your femur. So this is while able to static stretch. We did the test of range of motion for hip flexion, which is going to go ahead and stretch out that glute max. And then for this muscle, there's no passive and no active insufficiency. And let's hold it for 10 more seconds.
It's not a stretch, it's just ever since the yoga when we did in class, this side's been bad.
Hold it, sorry.
Yeah, I did.
Okay. So we'll go ahead and take a measurement again right now. So you can go ahead and lay on the table. And go ahead and out for your vertical there. Go ahead and internally rotate, externally rotate. Right there. Sorry. And going to your lateral epicondyle right there. Go ahead and do that hip flexion again on the right leg. Motion officially. Yeah, we pushed you actually just a few degrees, 120 degrees range of motion coming from your hip for hip flexors, but there's multiple muscles for hip flexors. So while it could help stretching out the gluteus maximus, we might have to also strengthen the hip flexors, just like the femoris and other muscles. Next muscle we're addressing is the tensor fasciae latae and the iliotibial tract. This muscle is in charge of hip flexion, medial internal rotation, along with abduction. This stretch, what I'll have Ashley do over here is, let me show and demonstrate to you. Since we are stretching out your right side, I'm going to is right side being stretched, right leg comes behind. And then you're going to go ahead and have your hips to the right. You should go ahead and stretch on that right side. Just go ahead and hold that for 30 seconds. While you're doing that, I'll explain the information. That its origin comes from the iliac crest, posterior to the ASI, so your ASI is right here, right behind you. And its insertion is the iliotibial tract, which is a long sheet band. It's all the way down on the lateral side of the leg. And then we actually do have a special test that we'll go ahead and perform right after we see if it has stretched out or not, called the Ober's test, which is going to be a sideline test, and we'll go ahead and show you how that's done. 30 seconds here. Alright, so now that you are sideline, we'll go ahead and have you, oh perfect, you're already in position for it. And it's like when the hip drop, look at that. negative. Well, obviously we want us to do the performance of it. So I'm just gonna go ahead and have your knee, hip, and shoulder lined up. I'm just gonna go ahead and do a gradual drop of the Ober's test right here. Perfect. Now that you have let it go, your knee is touching the platform. Therapeutic. You are negative on the Ober's test. It's our special test to show that, hey, if it's positive, you have hyperthermia. But because you're negative, it's nice, loose, and stretched out. Kind of tight.
Perfect. Never lose.
Right.
So now for the hip, we're going to go ahead and address adduction
This is static
specifically
stretch again. We're doing
for
static stretch
adductor
with all of
muscles.
these.
One of
So
those
when
is
she's
going to
done
be the
there,
adductor
there
longus,
is a
which
special
is
test
in
that
charge
we
of
do this week
adduction.
as well. It is
Yeah.
called the
So we're going to go ahead
test.
and do
So,
a range of motion
When you're
measurement
done, we're going to
for
get you at the edge of
her
the table. Kind of
abduction
stretching that way.
to go ahead and see how much
Pull
lengthening we can get
Because I have
out
to
of
kind of
stretching
off
the
table.
adductors
Sorry.
for a post test. So let's go with a pre-test right now. Place the station.
How do you feel with that one side tighter than the other? Still that left one where there's no gap,
There,
so she's good.
going prone
So,
systems.
since we're
And
addressing
then with
rep
this
them,
left
what I'm
leg,
gonna
you go ahead
do
and follow
is
the
I'm going
midline of your
to
femur.
get
I
the
want you to go ahead with
measurement
your left
of
leg,
her
kick it out as far
knee
left as you
flexion here.
can. Go ahead whenever you're ready. What's up?
And we are at 58 degrees on this side. Go ahead and relax. And then bring up that knee, same thing, knee to chest.
Possible that you can.
Then we're gonna address this other side, so we're starting
This is
here.
flexible. You can do splits. We got you over here at 71 degrees,
You are
man.
at 54
Well, I
degrees
did
on
see
this
some
one, so this
compensation
is a little tighter than that one.
over that. So we'll
So this is
still
a
go
special
ahead
test
for
to
70.
address
We'll go ahead and
rep
still
for
record
that
71
knee flexion
degrees,
as well.
don't worry.
She's
And
a
then
little
we'll see how
tight
much we can
for
go
rep
ahead
left,
and get
so
when we
knee
stretch out
flexion
the
is a little bit less. So
adductors.
that's a special
So
test.
let's go ahead and show her some stretches for adduction because we measured out
Bend.
her left
Your leg was kind
adductor
of
with range of
out
motion
like this
of
a little bit, so
abduction.
you can tell that your
We
right
can go
foot
ahead
was
and
a little
stretch out
tight.
that left leg as much as you can.
Yeah,
I thought her
Once you get a nice base,
that's for psoas.
wide. Once you go ahead and knee
Psoas is
down
for
on
hip
your right leg
flexion.
as much
That's
as
just
you
if you're
can.
back and your
And
knee is
stretch
off the
out
table.
that left one,
Your
keeping that
psoas is
leg
tight.
nice and
If your knee
straight.
is down, your psoas is
Feel-
fine, and
feel
but if your knee
stretch
is
coming over
extended
here.
more,
Yeah.
your rec
Go
bend
ahead
is
and
tight.
hold that for 30 seconds.
Yeah,
While you do that, our favorite time
because rec bend is the knee,
of the videos,
psoas is the hip flexors.
origin insertion. So it originates from the pubic tubercle. It inserts into the medial lip of the linear aspirate. Its actions are to medially rotate the hips, abduct the hips, and assist with hip flexion. Sideline like this, it's gonna go ahead and stretch that out, so you're doing the opposite actions.
T-ball, yeah, you're right.
And we did our range of motion with abduction.
You wanna do,
hamstring
hamstring extension rec bend?
71 degrees. And there is no passive or active insufficiency.
Nice.
Very
Can I
nice.
practice measuring like?
Go ahead and hold that for 10
Four times?
seconds. 10, 9,
99.
8,
Oh, yeah.
7, 6, 5, 4, 3, 2.
I watched them on the
Go ahead,
way
relax.
but every time I started, I fell asleep like.
And we go
Oh,
back.
I love to hear it.
So she stretched out her hip adductors with that adductor long stretch that we just showed and demonstrated. We'll go ahead and do the abduction range of motion test again to see if we have any lengthening occurring. So I'm gonna go ahead and palpate, find your ASIS so I can line it up. And then just look right there. Find your ASIS, nice full palms.
So think, if I'm here,
Movement arm here.
following the zero,
Go ahead once again, kick that left leg out as much as you can. Look at that, you dragged it for me.
But can you do it on both sides or no?
That's crazy. We got you at
Is that, yeah?
75 degrees.
So I lifted the video, she
You didn't
was
miss stretching
straight,
it
so I
out.
didn't
We
need to
got
measure.
you beyond
yeah,
range of motion.
and just saying if she wasn't, we'd want her to get her knees.
So now we're moved on to the knee, which addresses just two things, extension and flexion. With that, it's gonna be two muscles that we're addressing, the quadriceps, which is made up of 4 different muscles, so it's a muscle group, and then the hamstring group, the biceps femoris, semitendinosus, and semimembranosus in charge of knee flexion. So let's go ahead and address the quadriceps for knee extension. With this one, we'll go ahead. So right now we're going to go ahead and do the special test, the Thomas test, to address her rectus femoris and iliopsoas length. However, it is addressing the rectus femoris part of the quadriceps group to see if it is lengthened enough for her to be able to touch the table with with both her legs in this situation when we're testing it. So for the Thomas test, I'll go ahead and have you lay down on your back on the table, right at the edge, so you have your knees just right off the edge of the bed. And I want to assess your right leg, so what I'll go ahead and have you do is flex this left leg up, and you can go ahead and pull that. And I'm looking if her knee or posterior thigh pops off the table, and in this situation, I can't even put my finger to slide my hand underneath, so she's making contact with it on her right, so her right quadratus, her right rectus femoris and her right iliopsoas is loosened up. It's not tight and causing it to pop up. So negative on the right leg. Let's go ahead and assess with the left leg. So same thing with the left leg, just lay on your back. And pull that right leg, and I'm assessing your left leg. I'm trying to see if it pops up. Can't even slide underneath. So she is negative on both signs of the Thomas test for both legs. But we'll go ahead and still stretch it out for her, provide her something in case she does feel tight. With the quadricep stretch, this one is probably something you've seen most commonly in the gym. You could be standing with, just standing.
Yes.
You could just be standing with no equipment, or you could be against the wall, a table, a platform that you can go ahead and help stabilize yourself. Personally, I like having something to stabilize myself, so having an additional pull going on with my quadriceps. Just kick my heel back to my butt and pull. And then stand nice up and tall, so we can emphasize bringing this hip backwards and pulling that leg backwards, and hold that for 30 seconds. And that's going to go ahead and stretch out that quadricep on your right. That's why I have a lot.
How's that can do? 5 seconds.
No worries. And just hold that for 30 seconds. Right now we probably have 20 seconds left. While you're doing that, let's talk about torsion. Insertion. Its origin comes from the inferior iliac spine, the medial lip of the linea aspera, the lateral lip of the linea aspera, the gluteal tuberosity, same spot where the glute actually inserts, the greater shoulder canter, and the anterior and lateral shaft of the femur. What was that?
What was that?
If you would like to, yeah. Now the insertion is the tibial tuberosity from the patella and the patellar ligament, which is the special test for the Thomas test. And for active and passive insufficiency, this muscle actually does have active and passive insufficiency. You are right now in passive insufficiency with hip extension and knee flexion. But to go ahead and go into active insufficiency, you can go ahead and relax. Active insufficiency with just knee kicked out and max hip flexion. Yeah, you can't go all the way because active insufficiency. So that's the quadriceps for that. So now we're moving on to the hamstrings group, which consists of the biceps femoris, semitendinosus, and semimembranosus, all in charge of knee flexion. With this, we'll go ahead and do the 90-90 leg test. So for our patient, actually, you can go ahead and sit at the table for us and then lay on her back. With the 90-90, what I want you to do here is bring up your leg just like that and hold right behind just like that. Now I want you to go ahead and try your best to go ahead and kick up straight your leg. And I'm looking for knee flexion because I'm seeing this knee flexion even if I go longer. To address this, make sure go ahead and hold it as much as you can. Oh no, hold it. We'll do that. Lateral malleolus, step left, lateral compound.
Are you shaking?
I have her at more than 20 degrees. So she is positive for the 90-90 test, meaning she has tight hamstrings on her right leg. So what we'll go ahead and do is provide her stretch, go ahead and stretch out those hamstrings. So if you go ahead and stand up, actually, this is one of my personal favorites that I use at the gym to loosen up my hamstrings right before working out and after working out. This one for the hamstring stretch is simple. You can have a low table like this over here. You can do it on the floor. obviously, the higher, not higher, but the more off the ground you are, like a chair, the better. What we want to do is we measured your right leg. So with your right leg, we'll bring the right leg up to the heel onto the chair. Straighten out that leg as much as possible. And I want you to lean forward while thinking of driving your butt to the ground. That's going to drop your hip. You're going to feel this nice stretch coming right behind your leg. Again, keeping that knee straight and dropping that butt to the ground as much as you can, okay? And then hold that for 30 seconds. Perfect. So while you do that, I'll think it's time. Origin, insertion, and all that stuff. So for origins, this is coming from the ischial tuberosity. No, it's good.
Just do not stretch.
No worries, a lot of us don't. So again, this origin is coming from the ischial tuberosity, and the lateral lip of the linea aspera. Its insertion goes into the posterior aspect of the medial condyle of the tibia, so past your knee, the proximal medial shaft of the tibia at the pes and spinatus tendon, along with the head of the fibula, all past the knee. So while you're doing that, you go ahead and relax. It's active and passive insufficiency is what you were just doing, is stretching it. That was passive insufficiency. Knee extension and hip flexion. That puts it into passive insufficiency. It's most length and steady. That's why it's feeling good to stretch out. Active insufficiency, we're pretty much doing that butt kick. Knee flexion and hip extension. That's going to shorten up that hamstrings group to be in active insufficiency. So as you just stretched out, let's go ahead and do that 99 test again to see if there's any improvement in your range of motion with your hamstrings. So go ahead and kick up as much as you can. Let's see if you did improve at least.
Why does it look worse? It really does.
Hey, no worries. Maybe it's just not so much. Just gonna try that. That'll come out. Last one. Yeah, doing that now. And yeah, you're still about the same. So honestly, no worries. Go ahead and relax. No worries that you're at the same. Obviously, stretching once after not stretching for a lifetime is going to be
That's crazy.
very, very difficult. But obviously, start incorporating it every day.
Yeah.
Then go ahead and stretch out that
That's why I'm here.
hamstring.
Right.
That's why we're all here.
Yeah.
Stretch out that hamstring, and then we'll be good. And hopefully, that 99 test will be negative soon.
Yep. Yeah.
Now we're going to go ahead and look at the ankles motions.
Now we're going to be
This is
going
in charge
hip
of
here and below.
dorsiflexion,
And the first
plantar
we're going to
flexion,
measure is for the
inversion,
hamstrings.
and eversion.
The hamstrings
Show.
flex the knee, externally
Muscles do this
rotate.
is fibularis longus and the
External rotation of the hip,
anterior.
internal
So
rotation.
for us to go ahead and
That's semi-membranosus and
that for range of motion, if we can go ahead
external
and
is going
find
to be
improvement,
biceps femoris.
go ahead and do her
Hamstrings.
range of motion.
So
for the ankle.
well, I explain all that to you.
Started with
The
that.
O's and I's. I'm going to have you do the stretch here, which is going
Let's go
to
with
be.
your
What I'm having you
right
do
leg.
is that if you don't have balance,
Go
you
ahead
can
and have
use
this
the table or the back of this chair to stabilize yourself.
That mount.
What I want you to do
parallel to the
is your-
metatarsal, and then in line with the
I'm going to have you place a foot up, hinge at your hips, and then I'm going to have you go to reach and stretch
Now
until
we
you
go ahead
feel
and
the
address
stretch back
the
here in your hamstrings.
fibularis
So,
longus.
not too much
lengthening.
like
I'm gonna go
trunk
ahead and
flexion
have
for that.
you
Just hinge
with
at
your
the
foot
forward.
and up as much as
Yeah, you can stabilize here
Whenever
and
you
here,
are ready, go
both
ahead.
sides, 30 seconds. And while she does that, over the way, they all originate at the ischial tuberosity. The biceps also is at the lateral lip of the linea aspera for the short head, and then the
12
long head.
degrees right now for dorsiflexion. So we'll go ahead and give you some fibularis longus stretches. Go ahead and relax.
Ischial tuberosity.
And then what I want you to do with this foot is
So
plantar flex, which
semi-membranosus is going
ankle
to
points
originate.
down whenever
Oh wait,
you're
they're all
ready.
ischial tuberosity. Oh my gosh. Semi-membranosus inserts at the posterior aspect of the medial condyle of the tibia,
Walking.
and then semi-membranosus
60
is the proximal
degrees.
medial shaft of the tibia at
So
the pes
we'll go ahead and give you
and
stretches for the
tendon.
tibialis.
They all have different
fibularis
actions that do more than just
what I want you to
those.
Go ahead and do is put
that
that
I
right leg.
mentioned.
Go ahead and cross that.
Biceps
for me.
femoris, it tells
for
the pelvis
your
posteriorly.
Fibularis longus. Let's go ahead and do bringing your
Yeah.
foot inward
They
towards
all
your
tilt
chest,
the pelvis.
and then
posterior.
also bring that ankle up
Along
towards your knee. At the
along
same time,
with the knee flexion,
simultaneously, you should start
external
feeling
rotation,
stretch on this side.
And then
on
there
that
is
side.
active passive insufficiency with the quadriceps and the hamstrings.
That is your fibula, so long
As
as
well.
you're stretching.
Anyway,
Our favorite
so
time.
special test
The
we can do
origin
is
and
called the
insertion.
90-90 test. I know my
Well, the
patient is
origin,
very hypermobile
It comes from the
like
head of the
it is.
fibula.
But
over here.
what I'm gonna have you do is lay
Approximately
on
2/3
the
lateral
table here.
fibula. And then it goes ahead and
I want
gets
you
you
to
all
flex
the
your
way to
hips to
the
90
base of the first
degrees, so that
metatarsal.
right there. And what I want you to do
Here,
is place your
where your big
hands
toes
behind
are.
here and extend your knees as much as you can.
Along with the medial cuneiform.
You see it on the
Its
side
actions
here.
are to evert
So
the foot
she
and assist with plantar
can straighten
flexion.
her knee out. So
We're doing
she
this guy stretch
is
of
fine. She would be a
going in
negative for this
inversion and
test.
dorsiflexion,
But if
pushing
she
into
couldn't
your
do that, what we
leg.
want to do is at least measure
Obviously,
here
our
so she
muscle
has
length
70
test
degrees
was
of
doing
hip
dorsiflexion,
flexion
range
in
of
order.
motion.
So to say if she couldn't, if she
And then
could
there is
send it
no
out here,
active or
you
passive
don't want at least like
insufficiency.
70 degrees of hip flexion in order to do the action.
Perfect. So go ahead
So
and do that right
the
there.
other side is to test
Now let's
that
go ahead and
side,
stretch out the
but
tibialis
seems
anterior,
as though she's
which is the opposite of
perfectly
that.
fine
I'm
for
gonna go ahead
that.
and push down that ankle,
But
just
yeah,
like that.
that is a
and
90-90
outwards,
test for
down.
the hamstrings.
Just like that. Nice. Hold that for 30 seconds.
Quads was
Now, favorite time again, origin insertion. Origin comes from the lateral condyle of the tibia, proximal lateral surface of the tibia, and the interosseous membrane. Insertion
Let me see, where's
is the
the
medial
ball?
cuneiform and the base of the first metatarsal, just like the fibularis longus. Nice. Action are inverting the foot and dorsiflexing the ankle, hence why we're stretching it. And the
So-
opposite action.
Oh wait, was this the one that was at like?
Testing this is ankle plantar flexion of that ankle going down, hence why we're stretching it out like that. And then there is no active or passive insufficiency.
Nice.
Wow.
Eh.
Hold that for 10 more seconds. 10, 9, 8, 7, 6, 5, 4, 2, 1. Go ahead and relax. Nice. Let's go ahead and test that range of motion again on that right foot.
Well,
Is there a problem, patient?
I didn't say anything.
Oh.
I didn't say anything.
58, 80,
All right, let's go ahead. Same thing. Test that range of motion to see muscle lengthening. That mouth.
fifty to
Fibula.
80.
Fibula.
Let me try to measure yours right
Parallel
now
with
just to see.
Go ahead and do your dorsiflexion for me as much as you can. Ankle up. Yeah, nice. In line
I'm gonna
with the
palpate
fifth
here, okay?
metatarsal.
Yeah.
I'm gonna drop it down, but still stay in line with the lateral malleolus, so I get the best visible picture there. Nice. And we did improve
Let's see,
you.
okay.
To
Wait,
15 degrees.
At the knee.
Improvement is improvement.
But I'm falling.
Go ahead and
Yeah,
relax.
like the grand. I was like, wait, that makes it
Just
actually
breathe and
make
try to
sense.
find
I'm
that
falling.
fibula and fibula in that now. And whenever you are ready, go ahead and flex that foot down as much as you can, plantar flex. Get that now right here, sorry. Just trying to make sure everything's in line. You want accurate measurements.
50 to 80.
50 to 80.
Always, always accurate.
And you
For
have
that.
120.
Increased view.
One.
So whacking
I'm assuming, right? No.
64 degrees.
Nice.
Nice. Stretching helps.
I wonder if there's more for me.
Now
the top portion of here,
the
what I'm gonna do
foot and
is
the
lean
toes,
forward and
specifically
feel
stretching
that
those out
stretch in that arm.
with the muscles. So what we got to do is
And
the
so,
extensor digitorum longus
What
and the
this,
flexor
what the gel
digitorum
spray
longus.
does, by the way,
Flexor
is it
digitorum longus.
addresses abduction, so the
So,
shoulder
to
flexion,
get that
internal
stretched
rotation,
out, what we
horizontal
can go ahead and
abduction.
do, and also
Here's
for a
the
range of
track
motion,
anterior
is what we
fibers.
just did with
They
the
are
area,
going to
is
do
doing the
flexion, internal
flexion
rotation,
and plantar
shoulder.
flexion. That's one
Yeah,
way to
sorry,
go
either
ahead and
versus
do
the
muscle
shoulder,
lengthening,
horizontal
assessment
abduction,
with.
shoulder. So we're doing the opposite
So
right
for
now.
this
We're having her
stretch,
do external
we'll go ahead
rotation
and
to
do
stretch
iron.
out.
Since the areas are
The origin is going to be the lateral
Swing our
1/3 of the
foot together, just like
clavicle,
that.
the acromion, and
And
the spine and
for us to go
scapula.
ahead
It's
and
going to
stretch out
insert the
the
deltoid tuberosity.
flexors,
So we'll do a
we're
static
gonna
stretch for 30
opposite
seconds on
of the
both
action.
sides. With that,
So I want you to go ahead and extend those toes out and then
I'm
also
gonna
push
do
that ankle that way.
yes.
Pull that.
So we're going to take it over the part.
Stretch coming all the way.
So
I do.
that.
Nice.
It's a big stretch.
Perfect. So hold that for 30 seconds. I'll explain to you
Remember to pause it?
what
No.
the
Go ahead.
flexors are doing. So the flexors, it's originating from the middle and posterior surface of the tibia.
And
It
possibly by
inserts to the distal phalanges of the second and fifth toes. That's why we're
Tired.
going over there.
Okay.
Its action is to flex the toes along with plantar flexion.
So,
hence why we're going to dorsiflexion
I'll have her do
and
the stretch and then I'll have her
extension of
stretch
the toes.
the posterior and then we'll
Active
do measures
insufficiency
for
does exist with this.
horizontal
Right now
adduction and
we're pushing
adduction with
into
the
passive
going where to
insufficiency by
compare.
dorsiflexing
Obviously it
and
asks for
extending the toes, but we
verbal
want to go into active
statement
insufficiency.
to
We
ask
do
for which side
plantar
might
flexion
feel
and
tighter.
flexion of the toes.
For this
We'll
case,
go ahead
is
and
there
do
anything that
that
felt
on the next
tighter?
stretch.
My right side,
So
it's your
for
right
30 seconds,
side.
you can go ahead and
Okay.
relax.
So now if you
Now let's
can,
go
you can
ahead and adjust
sit
the extensor.
or you can
Did
stand for this
long
next
as
one.
how we stretch
What I'm having
those
you do
muscles.
is I'm gonna have you
We can go ahead
basically
and do
cross
it in the
your
same
arm
position
over
that
and
you
get the
hold.
other arm.
Now we just go ahead and
hold
do
it
the
and
opposite.
kind of
Let's go
pull.
ahead and stretch out
Hold
that
that for
hip.
30 seconds
Make
as
it nice and straight
well.
as we can and flex those toes, pulling them just like that.
That was a little tighter.
That's that
Yeah.
tighter one. Yeah. This one would make sense to be tighter. Just let's stretch out those extensors for us. While you do that,
No,
hold that for 30 seconds. I'll explain to you. Hey, it originates from the lateral condyle of the tibia and the proximal anterior shaft of the fibula, along with the interosseous membrane. Its insertion is the middle and distal phalanges of the second and fifth toes, once again, just like the fibular digits on lungs. And its actions are to extend and the fifth, second, or fifth toe along the dorsiflexion of the ankle. That's why we're doing the
So after that, I'll have you
opposite
stand
action
and
for stretching.
for both on
And
both sides.
Its active insufficiency is dorsiflexion and extension of the toes, and passive insufficiency, which you are doing right now, is plantar flexion and flexion of the toes. So you go ahead and rest
So we can
and
do
relax.
the right side. I'm gonna
That
have
is how we
you stretch your
out
arm
those
out.
muscles in the
Perfect.
toes.
We will
In case they're ever
measure
feeling
for,
tight, those are good things to equip in your
We'll do
arsenal.
abduction, so I'll have you
Go.
adduct.
Perfect,
So what I'm
thank
gonna have you do is
Uh-huh.
move your arm in